Hello and welcome to the webinar. I'm Dr. Chris. I will be your host today. Imagine living 70, 80, 90 years of quality health. What's the key word? It's quality. Imagine living that type of life where you're not dependent on a drug, a medication, or surgery just to get through the day and function. And imagine having predictable health. That means that you know exactly what you could be doing 5, 10, 15 years from now, who you're doing it with, where you're going. You have autonomy. That means that you're not dependent on other people to get through that day and to get through your life, and you're living life on your terms. But here's the questions we need to answer by the end of this time together. Number one, do you believe it's possible to live that type of life? Absolutely. We know plenty of people have, and I personally know thousands of people we have live that type of life. But number two, if you're watching this, the way your health is going and the direction it's going in, do you believe your body is capable of having and living that type of life? And number three, do you believe you're worthy of living that type of life? Well, we're going to go over all those questions today in this webinar today, and we'll answer all of them and show you how we are able to help thousands, tens of thousands of people be able to live life on their terms once again. So again, I'm Dr. Chris, I'll be your host, and I'm with Renew Life Rejuvenation, and we specialize in regenerative medicine. Let's go to the agenda today. Number one, this will probably be about an hour. We're going to go over an introduction of how we helped over 50,000 people doing 50,000 procedures and the life they've been able to get back. Then we're going to go over your symptoms and healthcare. Your symptoms such as you're watching this right now because you have aches and pains. You're having joint issues, shoulder, elbow, especially the knees, the hips, even the feet, and neuropathy and or osteoporosis, all those in there, those aches and pains. We're going to go over the healthcare options you have been given, and the majority of Americans have been given with less success, and other options that may get you well and live the life you were created to live. Then we're going to go over regenerative medicine, stem cells, allografts, and the science behind it. This is not going to be a cheerleading session on stem cells at all. I'm going to tell you the good, the bad, the absolutely very, very ugly. We're going to go over certain ways of harvesting stem cells you want to stay away from. We're going to go over exactly what the FDA says and what their standards and regulations are, so you can get all that information to make the right decision to help you move forward in your life. And then we're going to go over testimonials and success rates. We have thousands of testimonials on our site. You can go check that out, along with hours and hours and hours of research. This entire presentation is based off probably, if I stack the research, it's probably 2 to 3 inches thick. All that research is on our website. And if you're a researcher, please feel free to read that all. It will take you at least a week. All right, then at the end of this webinar, if you listen with your heart, if your heart tells you jump, go. If you feel that there's something in here, you feel excited about it, you feel this will be the next logical step to start moving you in the right direction, living life on your terms, then I will be able to give you an opportunity to book an appointment so we can move forward to see if you're a candidate. Fair enough? A couple housekeeping rules. Number one, if you're watching this right now, let's watch this together. Let's interact with this. So please put your phone on vibrate or airplane mode. I would hate for you to miss something here. Number two, take some notes, please. I want you to take notes because we're going to go over a lot of information as well. All right, so let's get to it. Right here, our clinic is located in the Woodlands, Texas. Renew Life, you can see that right there. What's amazing is that we have people at least once or twice a week fly in internationally. So I get to say, we're only 25 minutes from George Bush International Airport. So we're 25 minutes away from the airport, very convenient. And we have international people coming in and people driving in from different states. And we'll show you why they're passing thousands of other clinics and ending up right here in the Woodlands, Texas. So let me tell you my story, a little bit my story. Well, I'm Dr. Chris, and I have built in my life one of the largest wellness clinics in the entire world. In our peak, we were seeing thousands of people a week. This was my office and still is to a degree at peak time. So if you're seeing a bunch of people, families, all different ages, all different backgrounds sitting there because they're getting well without drugs and without surgery. And a lot of times I was the last option they had before doing drugs and surgery. So I've had over 15 years of helping you, someone just like you, get well without drugs and surgery. But I felt slightly impotent in the fact that I was able to help a person from their current day forward in their health. But if they had a lot of degeneration or joint disease in their body, or even far stages of neuropathy, I was not able to help them reverse the degeneration, all right, reverse it. But now we have been found technology to be able to do that. I speak all over the world. All right, here I'm speaking to hundreds of doctors right here. I speak everywhere on exactly what we'll be talking to right now in this webinar. But let me tell you the journey of how I got into regenerative medicine. All right, so I had my own personal journey with my health where I almost died of an incurable disease called ulcerative colitis, and I had to find my journey back to health in natural ways. But let me talk about you. This relates to you. Why did I find regenerative medicine, and why did I become a health advocate for it to teach you and the world? Well, it all is because of this woman right here. You're looking at my mom, and there's my son Titus. My mom is 81 years old, right? She looks great, right? She listens to me. She was no drugs, nothing like that, just doing amazing. But the day of 9/11 that we talk about 16 years ago, she got in a little fender bender and hurt her right knee. And I saw one joint, one right knee, absolutely debilitate my mother and disable my mother. What did it start out? She banged the knee, then did some rehab. That didn't work. Some therapy. That didn't work. Then they did braces. That didn't work. Then she did acupuncture. That didn't work. She did massage. That didn't work. Then Celebrex started coming in, steroid shots. And she's like, I don't want all these drugs, right? Damages the heart. That didn't work. Then steroid shots. Then they would wear off. And then all these other things, the knee got worse and worse and worse over time. And then the weight started to gain. She started gaining weight, right? Because subconsciously, you're taking the least path of resistance, right? She didn't walk anywhere. You don't want to go any places. Then the handicap sticker goes on the car, the car mirror, so she does not have to walk to get into places. And then Aunt Bonnie, that's my aunt, and that's her partner in crime. They used to go on cruises and travel overseas. All that started to stop. You know why? Because it required what? Walking. Her entire life was now being boxed in from this one knee disability she was having. And then you see my son Titus there. My kids live in Utah, in Park City. Everything's on a mountain, and all the homes, there's like multiple stairs and steps and high altitude. And instead of seeing my little guys every 4 to 6 weeks, it became every 3 months, 4 months, 5 months, a lot more FaceTiming. And I want you to understand something. If you have children or if you have grandchildren, I want you to understand this. And this is such a real thing that you may not realize, but I experienced it firsthand. My son's 6 years old in that picture. And your a young child has no concept of your arthritis, your neuropathy, your chronic aches and pains. They have no conception of what that is. Because when he gets an injury or a boo-boo, what happens? It heals when? Overnight. Or you kiss it and it goes away, right? So when my mom was like, well, grandma can't play with you today, honey, or I can't get on the ground, honey, because grandma has a boo-boo. In his mind, it's like, well, okay, well, that'll be over in a couple hours. Let me kiss it, it'll be gone. See, they have no concept. So because they don't understand your chronic conditions, your aches, your pains, your needs, all your joint problems and neuropathy, because they don't understand that, their little brain is searching for why. So when she didn't see them as often, he took it as, because he doesn't understand chronic pain like you're going through, he says, how come grandma doesn't see us as much anymore? And he said this, does she not want to see us? That's what your pain and condition is doing to your family. This little guy, because they had no concept. And so about 2 years ago, I said, Mom, listen, I heard there's stem cells out there, right? You guys heard stem cells or regenerative medicine. And she lives in Florida. I'm like, why don't you go check this out? Athletes are going there. Celebrities are going out of the country. Like, this is the new stuff. It's regenerative. It's bringing people's lives back. So she went to a dinner, some type of seminar in Florida. And she went there, had a Ruth Chris, came back in, and she got stem cells. She had one of the most ridiculous reactions, the worst experiences anybody could have had. Her knee got 2 to 3 times the size. She had to go back to the hospital because she was having a reaction to whatever they injected inside of her. And I felt so bad because here I recommended this to my mom. This is my mom. And I wanted her to get well. And not only 6 months later, she was worse. 12 months later, even further worse, right? So just a disaster. So that led me on the journey. I ordered the records, I saw the procedures, I saw what they did, I saw where they get the cells from, and I went on my own research, probably what you've been going through. I did so much research to find out what cells are, what stem cells are, the different ways of harvesting them. Then this whole world I was introduced to, and I really saw the details that this clinic or these clinics around the country totally miss, and people are not getting the results that they should because they're missing the details or they're not giving the proper regenerative medicine techniques and protocols to the patient. And so there's a lot of you out there that you might have been to different dinners or heard about this, but we're going to show you why we're different, why people travel for all over the world to come see us here, and what we're doing different, our protocols, which are different. So again, I'm going to show you the good, the bad, and the ugly. I'm going to take you through the journey my mom went through so it never has to happen with you. And we'll be able to get you good results that maybe you never would have gotten anywhere else. So I looked on, you've seen Dr. Neil Reardon here. So when I did my research, I saw a video of Mel Gibson, and the actor Mel Gibson. And Mel Gibson took his dad was in his 80s and was debilitated, horrible joint pain, hip pain, starting to get dementia, Alzheimer's, all these problems breaking down. And he went to Panama and he got his dad's stem cells. And his dad life absolutely changed. He's 99 years old now. So just say like in his late 80s, and like his dad's 99 years old, doing amazing. No drugs, no medication, walking, getting his life back. So when I saw that video for me, those couple minutes I saw it did it for me. So what do I think? Okay, Mel, I wasn't watching the actor Mel Gibson, even though I was watching a son of someone who wanted to save their dad. And I wanted to help my mom so bad. So I said, who's this doctor? Dr. Neil Reardon. He was in Panama. So in Panama, everybody flew in to see him in Panama. Well, then he wound up coming to Dallas, Texas to open up his signature lab. Meaning, he founded the Stem Cell Institute in Panama. He's the early pioneer in stem cells, 25 years. So you can't say this is new stuff. He's been in it for over 25 years. He has 70 scientific published articles, holds 40 patents, and most of them deal with the protocol, that specific protocol, and the type cells and how they're harvested and prepared for you, right? So there's exclusiveness in there. There's specific protocols in that. So Dr. Neil, he had his now the lab in Dallas, Texas, so it's in the States. And when we went to the States, he also wrote the book Stem Cell Therapy, A Rising Tide. It's a New York Times bestseller. And this is my team right here. We went to Dallas to actually go to his Stem Cell Institute. So when you went there, see, I did not only did I research, I traveled and met the people and looked at the people and looked at the cells. So not only did I see Dr. Reardon, but we actually saw the cells and they were living and viable. There's many clinics out there that the cells are dead, or if they're alive, they're barely, as I will show you down the road in a couple more slides. The greatest reason why I want to work with Dr. Neil that changed my life was when we talked to him. Number one, all he talks about is his stem cells. It is not his, but just the science of it and how he's helping people. In fact, he was offered over $300 million for his patents and for his clinics. And guess what he said? No. So he's not in this for financial gain. He's in this to change history, really, to leave amazing legacy. And anybody else, if they had what he was doing, would water it down. They wouldn't love it like him. He's obsessed with what he does, and therefore that's the person that I choose to work with. So I'm like, so I started working with him and another group called Vitality. That's our sister company. We have over 42 offices around the world, okay, especially in the United States. Now we're moving overseas. We've done over 51,000 procedures with amazing success, just over 94% success rate. All right. And no one else in the world could tell you those studies like we have, because we're getting those results. And I also saw you work with tons of athletes. So these are the athletes we work with. Now, remember, when a professional team chooses a company to work with, they vet them out. Would you agree? Would you agree? They just don't send their athletes anywhere. This is their investment, right? So they try different areas. So their athletes have tried other areas that did not work. So here's Taylor Gabriel. He tried a couple of things that didn't work. He went different places, and we found there's some techniques that we feel are outdated. So he told me what he was doing. I took about 15 minutes to explain, number one, what we do that's very different, are certain protocols. And he said, stop right there. He goes, can I get into one of your offices in Atlanta? I'm like, sure, what's going on? He's like, they were a couple weeks out, I think about 6 weeks out from the Super Bowl. He got benched because he had a fracture in his tibia, that's your shin bone, turf toe, and shoulder damage. And he's like, I'm not going to be able to play in the Super Bowl. This is my one shot. This is what I worked my entire life for. He goes, I want to try those stem cells. Can we try them out? And we're very positive, okay, but we also have very realistic expectations. And so, listen, we don't know if it's going to do the job. We know it'll help, but if you want to do it, we'll give it a try. So they actually put the stem cell allografts or the allograft tissue around the area of the fracture, the shoulder, and the turf toe. And 2 weeks later, this guy's going to be benched from the Super Bowl. He sent Dr. Chris a jersey signed with 2 Super Bowl tickets. And Dr. Chris called and said, listen, thank you so much for the gesture. He's like, no, you don't get it. I just got cleared to play for the Super Bowl. See, he got that opportunity back. If you could have that type of healing or those type of results, what would that mean to you? I'm going to show you exactly the difference of why it was able to happen to him. So yes, they lost in the Super Bowl, but he got the opportunity of his childhood dream. And so our medical team here in our Houston location, we have Dr. Cheryl Johnson, MD. She's been in practice over 25 years. And what I love about Cheryl is that she takes care of her patients and she always goes for the natural, holistic route first, not just giving you another pill and not just trying to cut something out of your body. So she does mission. She loves people in a natural, holistic way. And then we have Bradley Vessel, our top nurse practitioner, and he oversees the nurse practitioners. They actually perform the procedures. And when it comes to nurse practitioners, I hire one of 2 types, Division I athletes or in the military. Why? As you can see all those certifications, because if you know anybody in the military, do they pay attention to details? Absolutely. And I found out in my research and my journey, especially with my mom, the disaster is in the details that are not looked at. And in the military, they have to dress a certain way. Your bed has to be perfect. Why? They train subconsciously the details. There are no shortcuts. We are a no shortcut clinic. And then we have Dr. David Martino. He's our doctor to professional athletes, amazing seminar presenter, and he specializes in regenerative medicine and neuropathy, helping thousands of people all over the world in that area get their life back without drugs or getting amputations, which happens with neuropathy. So now enough about us. How about you? My question to you is, what has your pain cost you? Why are you watching this? You could be doing so many other things. You're watching this because you're suffering with orthopedic conditions, joint pain, aches and pains, osteoporosis, neuropathy. But my question to you is, what has your pain cost you? And there's a monetary value to that, isn't there? You could tell me why I spent this much money on supplements, on acupuncture, on chiropractic, on massage, on these braces, on these techniques, on this therapy, loss of work. And it literally, it adds up to tens of thousands of dollars, doesn't it? Add it up, it does. So you spent all this money and invested all this money, and I know I empathize with you just to be in the same pain and frustration that you started with. So even though money adds up with that, but I believe, and we should believe, that money is the least important factor here. And I think a more important factor here is the opportunity cost, the opportunity lost. What can you no longer do due to your pain and your symptoms? What is it? And what do you wish you could get back if you didn't have your pain and your issues anymore? And a lot of times I hear this: I want to walk normal. I want to be able to climb upstairs. I'd love to play with my grandkids. I would like to just not have to use a walker. I would like to avoid shuffling my feet. I would like to not be in pain. I would like to sleep normal. I would like to go on a vacation and be able to walk. See, my mom she wouldn't go on vacations because it took a lot of walking. You're not asking for something much. You just want to be out of pain. You want to be off drugs and medications. You hate the way you feel on them. What is the thing that you wish you could get back? And I'm going to show you how we have helped tens of thousands of people get back to what they wish they could do again and what they love to do again. And you could do the same thing too. If it worked for them, it will work for you if you're a candidate. Another question: what is your most important and precious commodity? What? It's health and it's your time, right? Money is not the most important commodity because you can make more money, but you cannot make more time. So time is the precious asset. So each day that goes by, is your health getting better or is it getting worse? Are you going towards health or towards degeneration? And the decision you make today, I am going to ask you to make a decision today for you. And you are going to make a decision regardless. A no decision is still a decision. And the decision is this: the decision you make today, as micro or small as it may be, turns your life into 2 parallel dimensions, right? One going towards health, healing, getting better, living life on your terms. And one is doing nothing. The problem's getting worse, disintegrating, drugs, surgery, and early death. Would you agree, right? So the decision you make today determines your future. Look at the nursing homes. Do you think anybody in their 5 or 10-year goal says, yes, nursing home? No, right? You think someone with neuropathy who has ulcers on their foot or got amputations on their foot, or someone who had massive knee surgery, they cut the joints out, a full reconstruction. Do you think anybody planned on that happening? Was it in their goals? No. So when do you avoid the full knee replacement and the joint surgery? When do you avoid the amputation? When do you avoid the drugs and surgery? When do you avoid them? Now. All right. So it's the decision you make out now. So it is crucial that I give you enough information so you can make the decision that'll take you forward to the life you want to have. Many people say that, would you agree that the healthcare system is broken? Sure. We're great in acute care, but acute care only makes 5% of the healthcare issues today. What is acute care? If you're having a heart attack, stroke, or massive car accident, this is the great place to be. But we're horrible with chronic conditions. What are chronic conditions? That is knee pain, joint pain, arthritis, osteoarthritis, neuropathy, and osteoporosis. These chronic conditions we're horrible at. In fact, we make up 5% of the population, take 75% of the drugs. We take 80% of the painkillers with 259 million prescriptions given out per year. And according to the World Health Organization, we rank 37 out of 37 when it comes to chronic conditions like you have. So it's not working, all right? So there has to be another way, because here's the current way today. Here's our typical healthcare system. And I don't think any of you want drugs and surgery, so I don't need to really hit on this hard. You go to Dr. Jones, and Dr. Jones is a great doctor, but he works in an insurance-based healthcare system. I need for you to understand that the insurance model eliminates and limits Dr. Jones's tools. No matter how much, like, why don't they pay for this? Why don't they? Because they do drugs and surgery. This is what they pay for. They'll go to Dr. Jones. You go to Dr. Jones with your symptoms. No matter what you say, Dr. Jones will prescribe you a drug. Now, does the drug get to the root cause of the problem, or does it mask it? It masks it. If there was a fire in your home, would you take the batteries of the fire alarm? If you take the batteries of the fire alarm, what's still there? The fire. It's absolutely no difference. If there's a check engine light and you put tape over it, is that problem still there? Yes. The same thing, even more dangerous with your body. So now you have these drugs and their side effects. And then you'll either be given more of that drug, raise the dose, or give you another drug. Now you're in polypharmacia. There's been no studies where someone tests with 4 or 5 different drugs in their body, the cross reactions. You have brain fog, you can't drive, you have all these other problems. Just you're sick, you're nauseous, you're sleepy because of drugs and medication. Now, when that doesn't work, then what's the next route? Surgery, all right? Now, it's not any surgery. You will always go to the best surgeon. Listen, I've worked with thousands and thousands of people, over 19,000 patients, and I've never heard one person that said they're going to the third best surgeon. For some reason, everybody goes to the number one surgeon. But when it comes to surgery, 25% of surgeries, 25% of those people are happy with 5 years later, meaning, hey, I got the surgery, I'm not perfect, but I'm glad I did it. And that means 75% are in still pain. They're suffering. They had revision surgeries. With knee patients, 52% of knee surgeries need a revision surgery within 1 year. And they show studies that 7 years later, people are still in the same pain, if not worse than when they first started, before the drugs and before the surgery. So when the surgery and revised surgery doesn't work, Dr. Jones has no other reason, but he has to put you on pain management. And what's that for? For life. We're talking opioids, Schedule II controlled narcotics. And no matter how much we can look and point the finger at an addict in the street that steals, that robs, if you are on those same medications, regardless if insurance paid for it and they were prescribed by your medical doctor, if you're on Schedule II controlled addicted opioids and medications, what will happen to your body? You will become an addict. Yes, you'll be addicted, just like any other addict. And a lot of patients that come in, they run out of drugs, meaning that they get through the bottle because they're in so much pain, they have another week to go, and they will not prescribe more drugs. And the pharmacy will red flag them, and they will take them from their friends. Or one patient even took it from their mother. This is the system you go through. So if you're asking me, does insurance pay for this? You're asking me, do you want a company, do you want a system like this to take care of your health? All right. So there must be a better way, and it is. There's regenerative medicine. It's an alternative for you, and we specialize in stem cells. One of them. That's one of the properties. So what's a stem cell? If you have not heard about stem cells, then take notes here. A stem cell is a cell that can replicate itself. And let's say we have we know this story. There's a stem cell from mom, there's a stem cell from dad, and 9 months what happened? You happen. There's a baby, right? 9 months. And we'll go into how that 9 months comes into play. A stem cell could also replicate and differentiate itself to other cells. Watch this. It could differentiate itself and regenerate nerve tissue, the toughest of them all. What would that do for your neuropathy or other nerve tissue or back or radiculopathy conditions? It differentiates into blood cells and capillaries, increasing blood flow and oxygen. What would that do for someone with neuropathy and/or erectile dysfunction? We have helped many men with erectile dysfunction with 0 medications. And how about it also differentiates itself into soft tissue, ligaments, and cartilage? OA, osteoarthritis, joints, regenerating joints, all that, it has the potential and ability to regenerate. Now with stem cells, research shows, and remember these numbers, write them down, that the regenerative properties, building that tissue in that joint or that nerve or those capillaries, that soft tissue, will happen between 3 and 9 months. Again, I'm going to say it again, 3 and 9 months. Research also shows the stem cells will continue to replicate in your body for up to 3 years. So remember, 3 to 9 months regeneration of that area, 3 years of replication. So stem cells control inflammation, very important, a huge anti-inflammatory effect. That's why you feel these results before the 3 months very, very quickly. They modulate the immune system instead of where drugs, they decrease the immune system, and they stimulate regeneration of the joints. And there's only a certain stem cell that does that, and we'll talk about that, which is here. Many chronic diseases are due to a lack or dysfunction of mesenchymal stem cells. Say that with me, mesenchymal stem cells. All the research you've seen with regeneration of the joints, all the great results is because of the mesenchymal stem cell, the MSC. But unfortunately, as we age, the number and function of our cells declines. Would you agree? Do you find yourself regenerating better or slower and weaker as you age? Now, the Mayo Clinic is so excited. They said stem cells and derived products offer great promise for new medical treatments. You notice they say stem cells and derived products. The allografts, I'll talk to you later on, they have 440 properties, therapeutic molecules in these tissues. Stem cells happen to be one of them. Also, the Mayo Clinic uses the exact stem cells that we use through Signature Labs. The Mayo Clinic, I'll tell you what they're doing, and I'll tell you why. I only could talk about certain things, but the Mayo Clinic is doing amazing research with autoimmune disease, scarring of the heart, helping people with heart injury, regain that back, spinal cord injury, and just amazing things that they're doing even for dementia and Alzheimer's. Now, the reason why I am only talking about orthopedic, neuropathy, and osteoporosis and osteoarthritis is because the FDA, they have, you ever hear FDA approval, FDA regulations? Stem cell allografts, the allografts we're talking about, they're not a drug, right? FDA approves drugs. They're not a drug. They're a tissue. They're natural occurring tissue in your body that replicates. It's you. So the FDA has high standards and regulations, and they leave it up to the state, each individual state, on the lane we could talk about and say we could do. So in Texas here, I could talk about osteoporosis, osteoarthritis, orthopedic joints, and neuropathy. But Mayo Clinic is still using the same exact cells. Time magazine says, new research suggests that perhaps we should consider stem cells one of the secrets to a longer life. You notice they did not say gabapentin, surgery, and other drugs and medication. They said, what? Stem cells as a secret. Now let's talk about where stem cells come from. It's very important we know where they're harvested from, and we're going to go over the good and the bad and the very, very ugly when it comes to this. Now the first area is embryonic stem cells, okay? Embryonic, where do they come from? They're derived from embryos, aborted fetal tissue. They're surrounded in controversy, and they are not legal for commercial use. We never, nor will we ever have considered or even touched embryonic stem cells right there. But the reason why I want to bring this up is because outside of the States, you might have a friend saying, hey, I heard in Costa Rica, they're doing stem cells, and it's a lot cheaper than those guys. All right? Well, you could be getting embryonic stem cells. In fact, you could be getting goat stem cells. I know you're laughing. Goat. Yeah, goat. It's been done. It's being done. So I will not advise that you travel out of state because it's not regulated, have the high standards of regulation that we have here in the United States. The next area of stem cells we're talking about is autologous. This means it's coming and harvested from your own very aging body, all right? So bone marrow stem cells, it's very painful. They take it out of your bone marrow. They got to incubate this stuff. Weeks later, after your iliac crest heals, they inject it back into you. And then you have adipose. They take these from your fat cells. Again, they pull them out, they incubate it, and then weeks later, they come back and they put it back into your body. It's coming from you. The problem with these is they can be painful to derive. They are very painful to derive. There's a limited amount of cells available, and these are cells from aging bodies that are less fit. All right. We had a lady the other day. She's like, are you telling me that I need to take cells from my body because my cells have not been doing a good job up until this point? And I'm not telling you to do this, guys. I'm just letting you know all the different ways and all the other areas that clinics are doing that we feel are not probably optimal for you. Because when it comes to these bone marrow and adipose tissue, yes, it has helped a lot of people, but we feel they're outdated. It's very similar to the old school cell phone. Remember that old big cell phone with the battery pack? Did it make a call? Yes. Was it $4 a minute? Yes. But let's compare it to your smartphone. All right, look at the difference there. So we're talking the old cell phones. It had its purpose. It had its time, but technology has absolutely advanced to get amazing, predictable results. So look at this chart right here. I love this. It says right here, as we age, the body's ability to regenerate damaged tissue decreases. This is because of the fitness of the stem cell in our bodies begin to significantly diminish over time. So this chart says it all. A newborn, a day zero cell, for every 10,000 cells, there's one mesenchymal stem cell. When you hit 50 or 70, it's 1 out of 400,000, 1 out of 2 million is a mesenchymal stem cells. So can you see how you age? The potency and the number of mesenchymal stem cells go down. So you can see where if you're 50, 60, 70, that if we took it from your bone marrow and fat, can you see how it would not be effective as a day zero newborn stem cell, that mesenchymal stem cell? You see the power of that? And not only does the potency goes down, but the replication power goes down, the regenerative power goes down. Right here, Dr. Reardon did a study showing that a 65-year-old mesenchymal stem cell incubated in 30 days would become or replicate to 200 stem cells, mesenchymal stem cells. But they said one of our allografts, the day zero, the newborn allograft, the fresh young allograft, one of those turns into over 1 billion stem cells in over 30 days. What do you think about that, right? So imagine 1 billion compared to 200. So which one will yield the better regeneration powers, the replication powers to get you your goals in neuropathy, aches and pains, arthritis, osteoarthritis? Which one would you want? The younger, more powerful cell does the trick. And we use the younger, more powerful cells. We do not rely on the aging body, the weaker, less active replicating stem cells. And the great thing about these allografts I'll talk about, the younger day zero allografts, stem cells, is it does not matter your age. If you're 50, 60, 70, 80, 90, 100, it doesn't matter because it's not prejudice. You put those younger, more powerful cells in anybody, they're still going to do their job correctly. Look at it this way. If you had young kids, remember when you were younger and you fell, or if you had grandkids and they cut themselves or scraped themselves, how fast does it take them to heal? Like 2 days, scab, gone. Now, the last time you cut yourself, how long did it take you to heal? Weeks? Months? So would you agree as we don't heal as quick? Well, now imagine putting these younger, more powerful cells. That's why you're degenerating, because you do not have the potency and the potential replication power of the stem cells, mesenchymal stem cells that you used to have. So where do stem cells come from? We went over autologous, that is from you, versus allograft. You heard me talking about allograft. Allograft is from someone else, and we're going to talk about the umbilical cord tissue. So many clinics may talk about umbilical cord, but you got to be careful. There's many places that they derive the tissue and or blood from the umbilical cord. One is super exciting and amazing, will change your life, and one, from my mom's personal experience, almost destroyed her life and incapacitated her. So let's talk about umbilical cord blood. I'm going to tell you about the experience with my mom. They injected the blood into her. Number one, her knee got huge. It got 3 times the size. Why? Because her body had a reaction, an autoimmune reaction to it. All right. So immediately when your immune system attacks it like that, what happens to those cells? They're dead. So $6,000 into the knee, poof, gone in probably a couple hours. But it doesn't stop there. She had to go get a Medrol pack of prednisone and antihistamines. it was a disaster. Plus she called and like, oh, it's normal. She's like, this isn't normal. My knee's 3 times the size. Very painful, fevery. So the FDA has recent regulations against cord blood, because anytime you deal with blood, you could transfer what? Disease and also chance of reaction. Plus, there's hemopoietic stem cells in there. They help increase red blood cells, and they would maybe be helpful in younger, very, very young cancer patients. And I'm sure I'm not talking to anybody that's a young cancer patient right now, so it will not be beneficial to you. And besides, it does not contain the mesenchymal stem cells. Remember, that is the stem cell, or that is the property therapeutic molecule that is going to give you the results that you're looking for to avoid drugs and surgery. Do you understand, right? So make sure it's the mesenchymal stem cell. So when you look at it right here, you could see you could take it from the vessel. That's the cord blood. Does not have mesenchymal stem cells. It's hemopoietic. The FDA regulations. In fact, the FDA, just to let you know, they're now going around and telling clinics to stop using the blood. In fact, they are shutting them down. And we are very, very excited about that, because our standards, our labs are checked every 3 months. We exceed the FDA regulation and guidelines, and we're in this for the long run with you. We're a team with you, and we're very, very excited that the FDA, the stricter they get, the happier we are, because now we're getting a lot of these other clinics that are really not doing the best care for you. We're getting them off the map, or the FDA is, not us, and we're just helping people the best way we can. And so where we take it from is, you'll see this, the umbilical cord tissue. You'll see the umbilical cord tissue, or the Wharton's jelly. The most dense and rich, plentiful area of mesenchymal stem cells is the umbilical cord tissue, or the Wharton's jelly as it's called. That contains the richest source of mesenchymal stem cells, and in addition, it has 0 biological markers for mother or child, meaning that there will be no reaction, like my mom had that reaction. You'll have no reaction whatsoever. So we're going to talk about our signature umbilical cord matrix, or the Wharton's jelly. It contains growth factors, cytokines, hyaluronic acid, and finally, mesenchymal stem cells. Remember, I said that this has 440 therapeutic molecules. Mesenchymal stem cells just happen to be one of them, but you're getting all the benefits of all these other therapeutic molecules. We have an FDA registered and compliant lab. Our lab is, again, checked every 3 months. And not only do we meet, but we exceed the FDA guidelines and regulations. And we're very, very proud of it. And we will brag about that, because that's something to be excited about. Now, let me show you the difference here. Because now we're talking about what? And we're talking about the umbilical cord tissue. So all the other ones, we're going to slide to the side. You can see the pros and cons. But now let's talk about the actual tissue. Now, other companies and other clinics have umbilical cord tissue from the Wharton's jelly, just like I mentioned. But again, not all are the same. You have to be educated and see the difference. On the left, that's what many other companies and clinics are using. You can see on the left side in the middle picture. On the right is ours. So you can see ours is pure white. Theirs are a little pink, all right? So when you see this right here, there's a little pink. What could be in there if it's a little pink? A little amniotic fluid, a little bit of blood, right? Also, when you see ours, it's pure white. Let's go back to this. Where do we get our umbilical cord? You're probably saying, well, where do you harvest this stuff from? We get our umbilical cord from extremely healthy mother, healthy baby, and healthy father. They are absolutely screened. It is a rigorous process, and they're absolutely super picky. If they have been in Florida or even near Florida during the pregnancy due to the Zika virus, they are disqualified. Through the pregnancy, they are followed through the whole entire pregnancy itself. Then during birth, they will not take the umbilical cord from natural vaginal birth, because they do not want it going through the vaginal canal. It's done through C-section only if it's a C-section baby. If the cord is around the baby at all, the umbilical cord is rejected. They are so strict on this. Immediately when the umbilical cord is harvested, after healthy birth, healthy mom, healthy baby are checked out, it's sent through liquid nitrogen or dried ice to our labs. At the lab, it's screened for endotoxins, diseases, purified, and now you see the end result. So if you look at the left and the right, the middle picture, we are the ones on the right. You can see it's pure clear, and watch this. Look at the bottom. You could actually see with the naked eye the tissues. So if you could see tissues with the naked eye, guess how many cells must be in there? Billions and billions of cells. On the far right, on the top, you're going to see what many companies are using. You might see a couple specks of tissue in here. And I don't have to look at the bottom, look at our tissues. Look at that. Look at all the tissues that are in there. Billions of cells. So when it comes to getting this wart and jelly, getting this great allografts in the body, which one would you choose to do? Which one's good, even though they're both umbilical cord tissue, which one do you choose for your health, for your neuropathy, for your osteoarthritis, for your joints, for your knees, for your hips, for your shoulders? Which one will deliver the best quality cells, the best regenerative and replicating capabilities for you? Now, also, let's look at the live and the living and viability of these, which means they're living and active. Here's our signature cells, allografts on the left, and other companies on the right. Now, you can see on the slide, look at the amount of cells that we have on the left, and look at the amount of cells that they have on the right. Again, they are still umbilical cord tissue. And let me give credit where credit's due. The company on the right, they have helped thousands of people. They really do help so many people. So showing you, but I just want to show you the difference of the amount of cells. Now look below that on the bottom, you'll see the staining. The green is the cytoplasm, the blue is the nucleus. You could see the viability of the living and active cells. Look on the left, that is our cells, the signature allografts. Now look at the right, that's other companies' cells. So even though the ones on the right have helped people, remember which ones are you looking for? Which ones would you rather do? Which ones you want to be sure that you get to give you the best results? I would say the one on the left. What are you? More cells, more alive, and more results for you as well. And that's why we have such success, is because of the type signature allograft cells that we use. Again, I want to really touch on this. The Warren's allografts, why do we use them? The body will not reject the umbilical cord tissue because they are hypoimmunogenic. They will not elicit immune response. And again, we're negative for those two biological markers, HLA1 and 2. Now let's get to you. What are the conditions we're going to be able, the Wharton's jelly will help treat on you? Do you have meniscus issues? That's knee issues. Ligament repairs of any ligaments of the body. Achilles all the way up to the shoulders and neck. Cartilage repair in the shoulder, hips, elbows, knees, ankles, any joints whatsoever. Tendinitis, tendinopathy, rotator cuff repairs in the shoulder. Knees, hips, spine, shoulders, elbow, plantar fasciitis. If your joint was not mentioned, do not feel left out. We just ran out of space. We have injected plenty of toes, plenty of fingers, all different areas of the body, the spine. If it helps these areas, we will have, and it will have the same regenerative healing properties as well in those joints that you're dealing with as well. I'm really excited for neurological conditions. We also, the Wharton's jelly also treats neuropathy, small diameter fibers, radiculopathy, that's the big trunk fibers that come out of the spinal cord, think sciatica, bulging herniated discs, and carpal tunnel syndrome. Well, look at the promise there. So if that's you right there, that is amazing. I'm going to show you how the nerve, being the toughest tissue to regenerate, if it can help these conditions, it's a walk in the park for any type of osteoarthritis or orthopedic joint conditions. Osteoarthritis such as disc degeneration, degeneration joint disease, stenosis, very painful, narrowing of the spinal cord, fractures, arthritis in all joints, and studies point to the use in bone loss or osteoporosis, osteopenia. If you have osteopenia or osteoporosis, most all of our procedures are directly into that joint or neuropathy right around the nerve in that area. With osteoporosis, you may be a candidate for a full body stem cell infusion. That's where we flood the body with millions and billions of stems of allografts and stem cells to then flood the body, as you will see the bone density rise in those 3 to 9 months. So if you come in, and you may be a candidate for the full body stem cell infusion. So let me show you the typical healthcare model in one of our clinics. So you come into Renew Life. So people, you either fly in, you drive in, you come to Renew Life, you will meet with one of our certified practitioners and case managers. They will sit down with you knee to knee, toe to toe. Now you'll have all your paperwork filled out, so it saves a lot of time so we could focus on you. When you meet with our practitioner, they will ask you questions. They'll go over what things have you done, what you're going through, what's the most important, what methods you have tried, what have worked, what has not worked in the past. And at that point, they will decide if we will go forward with you as a candidate. We do not accept everybody as a candidate. Reason being, we only want healthy patients, and here's the issue, healthy and happy patients, and there's two things on the line here. It's your health and your results, and it's our reputation. So if we want the best results and the best reputation, we will make sure you're a candidate, and we know it will work for you. We will not accept everybody. So we got to make sure you're a candidate. If you're a candidate and we choose to work with you and move forward, then we'll go into a level 5 exam. Here we might have to take some radiographs of your knees, pictures of your hips, certain exams we have to do. If you have neuropathy, we'll do a very non-invasive, non-painful neuropathy exam, but it's so thorough. It's one of the most thorough exams you'll get, and we'll be able to grade that neuropathy where you're at. We'll take pictures of the spine. We'll do any testing that needs to be done. And that testing, all of that will come as part of your consult. Then we will go over all the results. If you're a candidate and you choose to move forward and we choose to move forward with you, at that time we will secure your allografts, determine on how many areas you will get for the allografts. And now we're doing this recently, then you could actually even get your procedure done that very same day. If you live locally, it may not be that big of a deal for you, but because we have an international client base coming in, they want to fly in, they get their consult, they do their exam, and we could actually get their procedure done that day. It does not take long, the procedure, and then they're ready to go, versus having them to have to stay a week and then come back the next week. So we want to open that up for you. So understand, you could get your consult, you could get your exams, and purchase and secure your allografts that very day, and then we could actually give you that ultrasound-guided injection. That is the procedure. Very important here. My mom, they never took a picture of her knees. They looked at her MRI. They didn't even look at it. They looked at the findings, the piece of paper, and they just injected right into her knee. Meaning that we do ultrasound guided injection. Another reason why we have massive success. There's no guessing. There's no pin the tail on the donkey here. When we do an ultrasound, you could actually see the joint. And for many of you, the space right here, the space is hairs. It's so tiny. It may take one of another staff to distract it to really be able to get that needle in to inject these stem cells or the allografts exactly where they need to go. I will tell you right now, without the ultrasound guided injection procedure, they are guessing 100% of the time. Do not do it if it's not ultrasound guided. In fact, we allow you to watch it. We want you to see it, because a lot of times people have the thing, going on. We want you to see. You actually see it going in and putting the stem cells exactly where it needs to be. And again, why we have such success and people travel from around the world is because, number one, it's a signature allografts we use. Number two, we're very selective on who we choose as a candidate. Number three, the ultrasound guided injection. Then you will leave with the Band-Aid, right? So there's no downtime. You leave with a Band-Aid, and there's minimal side effects. So Doc, what's the side effects? There'll be a little bleeding at the site, but that's why you get the Band-Aid. Number two, a little stiffness there, maybe some bruising if you have any type of blood thinners in your body. But that's it. If you have neuropathy, don't be surprised if you start to feel things, because life is turning on again. There is absolutely no drugs whatsoever. There's no major operations. A lot of our surgeons and neurosurgeons that we work with that send a lot of patients to us, they love this, because every day they have to sit down with all their patients with a piece of paper that says an informed consent saying, listen, we can't guarantee this procedure will work. In fact, we can't even guarantee you will wake up. We will try our best, but please sign here. All right. None of that. You're not going to sleep. There's no major operations. There's no 6 to 18-month painful rehab that you have to go through and suffer with. And here's the most important part. Please understand this. There is only one injection needed to each site. With our signature cells, and you do exactly what our case managers, consults, lab, and medical staff tell you, it will only be one injection. It's one and it's done. Well, you said 3 years later it replicates. It's one and it's done. The cells and allografts we use are so powerful, and if you agree to the right amount we tell you to do, they will regenerate between 3 and 9 months. In 3 to 9 months, when that joint or that blood vessel or when that nerve is regenerated, what do you have to do to maintain it? Nothing. It's there. If it regenerates, it will outlive you. If it took you 50, 60 years to get there, even if you went back to a crazy life like you were in your 20s, it will not wear out. So there's only 3 reasons. Yeah, there's only 3 reasons why someone comes back for an injection. You ready? Number one, it works so well on the knees, or it works so well on someone's neuropathy, they came back to do both hips and both shoulders, right? Or they got just an intramuscular one to flood the body to have more mesenchymal stem cells in their body for health and rejuvenation. Number one. Number two, someone shortchanged the stem cells, meaning like if we suggest, listen, we recommend that you do one area on the left knee, one area of the right knee, or in neuropathy, one area on the left leg, one area of the right, due to the condition and severity it's at. Some might be like, well, can you just do one area? And one area just think is volume. Can you take one area and just divide it? So what happens, you're still going to get results. You're still going to be happy and regenerate, but not the way we know you could. So that person comes back and then they finish, they get the extra cells. It's a little bit more expensive because came back, they didn't get in volume, but they come back for that. They're like, yeah, you were right. And then the third reason someone pointed out to me the other day is if you make it to 120 years old or 126, yeah, you'll probably need another procedure. But guess what? If you make it to 120 or 126, I'll comp you on that procedure. All right. So that's the only reasons, but it's one and it's done. Another example. If I hired contractors and they took 3 years to build your house, once they built your house, they say, okay, we're done, and they walk away, what do you have? The entire house. So the stem cells do their job, they regenerate, they take off, but you have all that beautiful tissue there to regenerate, and you're living life on your terms again. So let's show you what we look for. So when you see, we take imaging, can you see on the left, look at that knee. See that disc space? It looks like a mustache in that knee. It's aligned. See each sides are aligned. You have a beautiful, all that black where it's a little shadowed in there. It looks like a mustache. That is cartilage in there. You've seen all that cartilage in there. Now look at the right. Can you see the difference? The knee, this one is shifted out. It's not aligned. It's rubbing bone on bone. See how narrow the disc space of the cartilage is? So this person's in extreme pain. So what is this pain coming from? The person lost what? Or you lost tissue. See, you lost tissue here, therefore the tissue, losing the tissue, and then this bone being out of alignment is causing your pain. Neuropathy, you lost tissue, right? Those nerves degenerated. The blood vessels degenerated, losing tissue. When you look at the hip on the right here, it should be a ball and socket. You need to have beautiful tissue around the ball and socket there. Look on the far right, it looked like it random into the pelvis. There's a tiny, tiny little bit of joint space in there. As long as you have joint space, you might have been told you have bone on bone. We hear it all the time. The majority of people, we could still help. You can be bone on bone, but if we see you have even the slightest bit of disc space, the little slightest bit of tissue, those allografts could work with that and they could regenerate. So when we see even the slightest bit of joint space, you will still be a candidate. But I want you to understand the cause. Your doctor, medicine has never told you the cause. Because yeah, they do. They say it's your age, it's your old age, it's your genetics. It's all baloney. It's all baloney. It's not your age. I'll tell you why. Because if it was your age, all your joints would look like that, and they don't, right? So forget the baloney, right? The reason why you have pain in that joint or that neuropathy is because you lost tissue, nerve, capillaries, cartilage, soft, you lost tissue. So the goal is, the cause is loss of tissue. We need to do everything that restores tissue. Understand? Now, with this person, sometimes when you see knees like this person right here, even someone has a good-looking knee, sometimes the better-looking knee has the more pain. Why would you say that? You would think it would be the less pain, but a lot of times when one knee hurts, what do? You shift your weight on the other side, and shifting that weight step by step really accelerates degeneration and damage to the other knee. So what we do is we do one area per knee. We fill the allografts in both areas, even the one that's less degenerated. You must do both areas. That'll give you the best results because you want both those areas to stay healthy and well. But if both knees are, looking good, you might be able to get with one area, split them on the two. But most of the times it's two areas. Loss of tissue. So what does medicine do for loss of tissue? We know, does medications, NSAIDs, and opioids restore tissue? The answer is what? No. How about Synvisc, Orthovisc, Suparts, Rotator injections? We're not negative against those, but they're like WD-40. They do not regenerate tissue. You got to keep on going, on and on. They're not, and just as you still degenerate. What we are negative against is cortisone or steroid shots. Have you gotten a steroid shot before? Most of you have, right? And I bet you most of you had more than one. The reason why we hate cortisone shots is because two reasons. Number one, it's unhealthy for you. They wear off because it doesn't work, but it actually destroys tissue. So what was the cause of your problem? Loss of tissue. Cortisone destroys tissue. You could stick that in a scar and the scar devolves. It crystallizes your joint. You're stamping your future surgery with cortisone injections. It destroys the joint. It's robbing Peter to pay Paul. And then when you have surgery, you have a painful 6 to 18 month rehab there. Does that restore surgery? No. And you cannot restore tissue in a knee replacement. It's not even a joint anymore. So this area is not working. This has not been working. In fact, in Iowa, they brought regenerative medicine to Iowa. Remember, the FDA leaves it up to the states. So they did two separate studies. One was the insurance-driven healthcare model, and one was the alternative rejuvenation model. So they did 223 patients, two groups, With a knee replacement, it was $70,000 was the average cost of a knee replacement. The 23% suffered serious surgical complications. Now with the stem cell study, the average cost was $15,000 to $17,000. Much, much cheaper. There was no significant complications, none. 90% of the patients had greater than 50% improvement. Now on the knee surgery side, 1 to 2 will die, 1 to 2 had pulmonary embolisms, 1 to 2 will suffer heart attack, and 11-14 required readmission for serious infection. And this is a surgery with rehab and all the other painful processes, but here, no surgery, 90% of the patients had greater than 50% improvement. Would you love right now a 50% improvement of where you're at? And 50% of the people had over 75% relief. Would you love to be the person that says, yeah, I have 75% relief? This is a study that was done. So which model do you want to be in? So if the one on the left, you're like, well, on the one on the left, my insurance will kind of help out with, do you want that model? I mean, look at what that's doing. How about this? How about investing in yourself? No surgery, getting real results, getting to the cause of the problem, and living life on your terms. That's a decision you have to make and invest in your health. Because here's the thing, you're spending all that, look at all the money you're spending with pain and sickness and loss of work and suffering versus something that's no surgery could get you the results you always wanted, that you're really looking for. This is the reason why if someone says, how come insurance doesn't cover it? Because it's not a drug, it's not a surgery. This is the Medicare guidelines. It's right for the Medicare guidelines. And I want you to, don't fight it, don't get upset at it, but be aware of the truth. A treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of your life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed what? Not medically necessary. So you could get upset about it. You're like, I can't pay all this. So what are you going to do? You're going to get the surgery? You're going to be on drugs? You're going to be on pain management? You're going to go through a system that destroys the quality of your life and takes you away from this planet earlier? Or you'll be like, hey, right, I choose not to play part of that system. I choose to take control of my own health and then live life on your terms. We did a study with our 51,000 procedures. Out of 51,000 procedures, we had 19 complications. None of them were serious. And what were they? They got called in. We're bruising. Yes, you have Coumadin. You're bruising. There's a little blood bleeding. Great. Keep the Band-Aid on. And our neuropathy patients called in saying, there's more tingling in my hands and feet, because I said, yeah, your nerves are turning on again, right? So none of them were serious. So there was a 23 compared to this 23% of serious complications. We had 0.00037% complications. So which one is safer for you? Which one has no effects that's going to cause you harm? So which one would you want to try? Because a lot of times what? We want to avoid pain, right? We want to avoid complications. So which one is going to be the best for you? Look at that. Look at that rate. It's amazing. And you know what? I can't tell you that we could guarantee 100%, right? No one could guarantee you 100% success rate on anything. So I'm not going to sit here and say, yeah, 100% of the time, I'm going to promise you're going to be perfect. Can't do that. It's unethical. Anybody that gives you a guarantee, it's unethical, right? But what I can do is I could share with you over our 51,000 procedures, our patients' success rate. And success rate means that they were able to get back to what they wanted to love and do again. They were able to reach that. So remember, it's not that you're out of pain. I'm happy about that. But it was that they got their life back. They're able to do what they want to do again. So our success rate is 94.4%. So if you're a person that's looking for a 100% guarantee, the only 100% guarantee you have is if you do nothing about it, what's going to happen? It's just going to get worse. So are you willing to take a 5.6% risk to do something that could get where the other 94.4% could pretty much guarantee a success rate in which you wanted to have? Look at that success rate, and you could be part of that success rate, but only if you choose. We're not going to force you. Have to choose that for yourself. Look at this right here. Is amazing. Look at this cartilage tear on the left. It looks like torn clothes. On the right, in 12 weeks, look how it healed. That could be healing right now. That could be your cartilage healing right now in your knee and your shoulder and your hip. That's only 12 weeks. So what do they have? They have 6 more months of regeneration happening. And what happens when it's regenerated? What do you have to do? Nothing. It's done. Dr. Reardon had a study showing that there was a 75% increase in cartilage thickness at only 5 months. with 4 more months left of regeneration in your body. What if that would do it? They're like, well, I'm 80 years old, I'm 90, I'm 50. Age is non-dependent because the allografts are coming from younger, more powerful cells. We follow up with everybody on a pain scale. The pain scale of 0 to 10, 0 means no pain. 10 is ridiculous, like childbirth or passing a major kidney stone the size of a walnut. Now look at our pain level. Where would you rate your pain level right now? So if you looked at your pain level right here, if you looked at your pain level on your worst day, answer to me right now, what is your pain level? Is it a 7 on your worst day, an 8, a 9, a 10? Some of you might say a plus 20. So look at these 8, 9s, and 10s. And within 6 weeks, they traded the 8s, 9s, and 10s for 0, 1s, and 2s. If you could get those results, what would that solve in your life? If you get those results, what would that mean to you? Would you trade an 8, 9, and 10? Would you trade a 6 right here for a 0? And ask yourself this, what number would you want to go down to be happy? Now 0, of course, 0, we all want to see 0, yeah. But what number would you like to get down to that you would say, you know what, I would be thrilled with this. It would be the greatest investment and use of my life and my time. What would it be? 3, right? Would you be happy with a 3? So that's the results we're getting. And that's 16 weeks, 5 more months of regeneration. And once we're at this state and we have regeneration, what do you have to do? Nothing. It's one and done. So what is back pain caused from? A lot of our neurosurgeons we work with, they say it's not necessarily the disc. They look at the disc, it's loss of tissue. Look at the disc there, right? It's the facet. That's where the nerve comes out of. Look at L5S1. Look how bad that disc got. So if you've been told you have bulging or degeneration in your back, look at that. It crushes the facet down. That nerve gets choked off. So when it comes to the back, we don't even have to go into the spinal cord. We don't have to go into your spinal cord or into your spinal canal. The allografts love inflammation, so we go paraspinal. Right on each side of the spine, those allografts migrate to those areas to help regenerate those tissues. Here's a gentleman right here. We can see he had a bulging disc before. You see that on the left, that bulging disc, and you can see the spinal cord. It looks like a white river. See how the bulging disc is crushing into the spinal cord? Your spinal cord is your lifeline, agree, right? The brain controls every part of your body through your spinal cord and nerves. So just think the organs, cells, tissues that supply, are they getting healthier or sicker? He did not want to do surgery. He says, listen, I didn't try everything because if I tried everything, I would have had my health, right? So he knew he didn't try everything. He says, let me try this before surgery. 5 months later, you can see the disc has been healed. There's pressure off the spinal cord, avoided surgery the natural way. If this could have results with you, what you're going through, what would that mean for your life? So here's a question. What tissue takes the longest to regenerate? Is it bone, skin, muscle, cartilage, capillaries, or nerve? And the answer is, what is it? It is nerve. It is the toughest tissue that takes the longest to regenerate. So we're going to talk about peripheral neuropathy. It's a very dangerous, debilitating disease. And if I could show you and prove to you and show you pictures that we could restore nerve tissue, the toughest tissue to regenerate, what do you think it'll do to your soft tissue, your cartilage, your joints, all the areas you're dealing with, and your neuropathy? It will change and save your life. Neuropathy is a linear disease, meaning this, guys, it is going to get bad, and it's not stopping. I should actually make this a slide. It's a sliding scale. If I took a 1-inch skin punch of your foot, there would be 150,000 fibers per square inch. There's no problems, no issues, no loss. As you start to lose and those nerves degenerate towards a 50% loss, you'll start to get loss of feeling. And if I'm speaking to you, nod your head. Loss of feeling in the foot or the hands, loss of balance. Let me talk about that. I had a gentleman said, yeah, my golf game, yeah, I'm just losing balance a little bit. Time out. Loss of balance we're very, very serious about because there's an extreme amount of mortality in relation to falls in the elderly. Would you agree, right? Loss of balance, this is priority for you. Don't take that lightly. Loss of temperature control, loss of movement in toes, loss of sleep. At 50% loss of those nerve fibers, pain starts. So pain is the last thing to show up after an ongoing disease. And then as it gets worse, over 50% loss, you're going to start getting burning sensations, freezing sensations, pins and needles, stiffness and achy areas, and electrical crawling pains, like spiders running on your hands and feet. Our patients call this crazy town because this could all happen in one night. You have all these, because now there's abnormal signals to the brain. Then you don't stay anywhere. As you approach 90% loss, now you start to develop foot ulcers that often lead to what? Amputations of the foot. And you might have neuropathy or the beginning stages. Our goal is to find out where you are on this spectrum and get you to reverse it and restore function as much as possible. And now I heed the warning. You might be watching this and you're like, yeah, not that bad. I'm a 4, I'm a 5. And here's the thing, in the back of your head, you're believing a lie that it may not happen to you. But now I'm going to show you pictures of certain people, and these people never thought it would happen to them. People in the nursing home never thought it would happen to them. So I'm asking you to future pace how you're going. Things will not stay the same. They only get worse. And so the thing is, it's much cheaper and it's much easier to correct your problem now than to wait until it's too late. So when you look at the brain right here, just a real schematic, the brain sends life through your spinal cord, out the nerves to the small diameter fibers. Now, the damage, the nerves have degenerated and the blood capillaries have dried up. That is the cause of the neuropathy. Now, where does that cause from? Toxicity, sugar, chemo, trauma. Medicine will say it's idiopathic. They don't know, and you know what? It doesn't matter how it got there, it's there, and we must restore nerve and we must restore blood flow and capillary supply to the nerve in the area, correct? But because what happens if you don't, it sends incorrect signals to the brain. So medicine's solution is gabapentin, Neurontin, Lyrica, and Cymbalta. Their solution is drugs. And drugs, do they regenerate the tissue? No. What do? Let me go back, what they do, they shut the brain down. They're anti-epileptic drugs, they're antidepressants, they're there to actually shut the brain down from even feeling things. Example, I had a lady that came to one of my seminars the other day. She had a boot on her foot. I'm like, oh, what happened? She's like, I broke my toes. I'm like, oh, that had to hurt. She's like, no, it didn't hurt. I woke up in the middle of the night to go pee, and my foot hit the bedpost. She goes, I'm on so much gabapentin that I didn't feel the pain, but I heard the crack. And she cracked her toes and broke her toes. So those drugs, and the worst is when they stop working, and that's all they have for you. Like, sorry, just it's drugs and surgeries, or we'll wait till it gets that bad and we'll amputate. All right. So let me show you what we want to do is we want to restore that nerve flow by regenerating the nerve. But first, we have to restore the blood flow in the capillaries. This is my favorite slide. So right here, you can see our patient pre-op. You can see there's very little very little blood capillaries and blood flow. At 4 weeks, we could start to see the capillaries regenerating and recreating. Look at 12 weeks when we really start kicking in that 3 to 9 month of regeneration. 24 weeks, look how healthy and look at the blood supply in that area. Beautiful. What would that mean to your neuropathy? It's reversing the neuropathy, or blood flow anywhere. Like I said, erectile dysfunction, anywhere that blood flow is necessary, it delivers oxygen, nutrients, and immune factors. Here's a neuropathy study showing this. If you're watching this and you have a high blood sugar whatsoever, you have a very high chance of developing neuropathy right now. And research also showed that stem cells were amazing for systemic neuropathy. But what I'm more concerned about with you and more happy about is this. It shows that stem cells reverse degeneration of the nerve and it actually restored the function. So we see thousands of people telling us daily how their lives are totally changed, but now we're showing you the research. You know, for those of you who want to do your research, remember, it's 3 inches thick of research. We're showing you that not only can we stop our allografts, it's not necessarily our allografts, your brain, your body tells these stem cells what to do. So I don't want you to think that we put these in and we have these, no. Your body tells these intelligent allografts what needs to be done. And then the stem cells not only stopped peripheral neuropathy, but actually even reversed it. So let's see the truth, even if you're squeamish. So I'm going to show you some pictures, and I'm showing these pictures. Why? Because these people did not think it would happen to them. In fact, these pictures are so bad, you're going to be like, how on earth would the medical community allow it to get this bad? I'll tell you why. Do you know how much money these people have to spend to deal with these problems? And also, when these problems get to this point, medicine cannot help you. It's too far gone. It's too fast. Let's get to it. You ready? Here we go. Look at that. Diabetic ulcer. Horrible. Over a year trying to use skin grafts, antibiotics, maggots to clean it, hyperbaric, you name it. Over a year, this person already lost their toes. So you see what neuropathy is doing to this person's life? What do you think has to go on with this foot? It's got to go what? It's got to get cut off. But the family decided, no, we did not try everything, because if we tried everything, we got a result. And this person is so frustrated because this is not healed. Imagine over a year, this is open like that, and the infections. You ready? Gets the allografts 9 weeks later. Look how that young strong cells and tissues healed itself right there. Now you can see up the leg and the shin. Look at the discoloration. Look at the ulcer on the shin. This person has very bad neuropathy. If they did not find regenerative medicine, they were going to wind up cutting this person, his whole entire leg. Well, they'll probably right below the knee, cut it off right up in there. So not only did this person not have to get a surgery, but now they have a second chance. No matter where you're at in neuropathy, I have to warn you, this is where you're headed. This person did not think it would happen. But when you get to a certain stage, there's no drug, there's no antibiotic that's going to help save it. There's no diet that's going to help save it, but this person now has a second chance. The next picture here, this is osteomyelitis. That is someone's calcaneus bone, your heel bone, sticking out. Again, years trying to deal with this wound. Why didn't they cut it off, right? They're trying to save the foot. No one wants to just cut off your foot. Family very distraught. Remember, if we cut off a limb, it changes your identity. They opted for the stem cell allografts plus antibiotics. Look at that. 9 weeks later, that young, healthy tissue starts to repair. Why? Because they're flooded with mesenchymal stem cells. It's what little kids, right? Little kids' cuts heal. This is what's happening. 45 weeks later, it's reduced to an unsightly callus. But guess what? They have their foot. And you know what? You might not like these pictures, but listen, that was a person who never thought it would happen to them. So wherever you at, if you have any slight, even the slightest bit of neuropathy, you get your areas done. We restore those areas. We bring you out of the disease process so you can live life once again and not have to worry about this. When you look at our pain scales, look at this. We have a lot of 9s and 10s with neuropathy. And those 10s are crazy town. Like I said, they're driving them crazy. And in 16 weeks, they traded 9s and 10s for 0, 1s, 3s, and 4s. You're like, wait a second. They're not, there's a 3, there's a 4, there's a 5. Well, it's nerve tissue. For those of you watching it, it may take the full 9 months. But look at this. Would you trade a 8, 9, and 10, a 6 for a 0, 2, or 1? And let me tell you about number 5 here. This is a gentleman who says, I refuse to change my life. He's like, I love my smoke, I love my drink, and I love my sugar. I'm not going to do it, but if these little guys, if these little suckers, he said, could get me any relief, I'll be happy. So he was thrilled with a 5 because he didn't want to change his life. So when you get a second chance, we don't want to abuse the body, and we'll teach you the recipe. We'll teach you the recipe and results to keep well and stay well versus the recipe that may have gotten you here. So let me get back to my mom. So thank you so much for going for the journey with me. So you see, it's regenerative medicine isn't just, oh, everybody's the same. They're not. There's a very specific thing. The details are crucial, and there could be no shortcuts, and value has to be sought out, because I was doing this for my mom, and my benefits from my mom could go to you. So now I found a way to get strong, healthy young cells like my son has, who's 6, into my mom's 81-year-old niece. I found a way to do it. A way that wouldn't cause a reaction and would get her the results she wants. So my mom came in, look at her knees, guys. There was so much damage. Look at the edema, swelling, and chronic inflammation. Her knees are getting knock-kneed because of all the pain and swelling. And look at that, destroying her feet and her knees. And you can see on her x-rays right here, her knees are going in like that. On her right knee, you can see there's the right. She lost about 75% of the disc height, bone touching here. But look at the left one. The left one's really bad. Arthritis, it's shifted. So my mom, we did one area of allografts on the right, one area on the left on each side. We also fitted her with an offloading brace because as those stem cells are healing, we want to align those knees correctly to take the pressure off the joint, open the disc spaces. So we have a protocol for that so that area could heal correctly. So here was just a couple days later. You can even see immediately, mom's like, look at the inflammation went down. You could see the Band-Aids, right? And, you know, she was already getting results. I said, hey, Mom, how are the knees doing? And she's like, fabulous. She's from New York. I can't believe it. I can't get fit it for my brace tomorrow morning. Love you. She kept on saying, I can't believe it. I can't believe it. They feel so good. They feel so great. Did it work already? I'm like, well, I go, there's no new tissue there, but you're feeling the anti-inflammatory results, which are amazing. So you will get instant gratification, even though it takes the 3 to 9 months of regeneration and replicates for up to 3 years. But this picture right here means the world to me, and it should mean the world to you, and I wish this for you. You see my mom about 12 months after her procedure. During that 12 months, guess what started to happen? She started feeling better. And when you feel better, You start wanting to take care of yourself. Then she starts walking on the treadmill a little bit. And then she's able to go upstairs, up and downstairs. Still a little bit sore going downstairs, but very quickly, these things are righting themselves. Not using elevators as much anymore. The handicap thing on her car mirror gets put in the glove compartment box. She starts losing weight. In fact, she lost the 40 pounds. She's off all the Aleve and Advil and all the anti-inflammatories she was taking when she was in pain. She's able to sleep better. She's resting better. She's healing better because her body's healing. She started going to Utah a little bit more often. Now, instead of every 3, 4, 5 months, it got back to every 6 weeks. She's able to walk in the altitude, walk uphill, play with my kids, and enjoy the loves of her life. And what's even more excited about that is she's able to enjoy her life again. You see my mom sitting there looking young, looking happy, and she's older, but she regenerated her knees, and you see her with Aunt Bonnie in Italy enjoying a beautiful meal. She got all of her opportunity back. She was one of the success stories that we have, and to me, her success is as meaningful to me as your success will be. But again, you have to choose to do it. I went through a hell of a journey. My mom went through a hell of a journey. We saw what was done correctly, what needs to be done correctly to get you the results that you deserve to live life on your terms. And let me show you the difference. On the left, we're going to go over the other offices, other common regenerative stem cell offices. And now on the right, we'll show you the Renew Life Success Method. Number one, these other offices, they're cheaper because they try to win you over with price war. And you know what? You get what you pay for. When a company says, oh, we could do what they do at Renew Life except cheaper, no, they can't. No, they can't. They're taking advantage of that person. We have higher costs. We are the highest cost because we have the greatest signature stem cells that are out there. In fact, we have exclusive. We own the region of Houston, our area. There's very few clinics that signature Dr. Reardon will work with, and we're one of them. So we're the higher cost cells, but they're based on value. Remember, this was to get my mom's life back. This was not a business. This was to get my mom's life back, and you now benefit from it. Everyone is a candidate at these places. There's no true screening. We do not accept everybody. We want you happy. So therefore, it's your health. It's our reputation. We only accept people that it's gonna work for. And we'll tell you, there it is or there it's not. They have lower quality and lower potency. As you saw those slides, right? There was lower cells, lower live cells. We have the highest quality stem cells in the US. Cord blood, they use cord blood, adipose, and marrow tissue. Remember, a little bit outdated, weaker cells, we believe, just not the greatest technology. We have umbilical cord matrix, Wharton's jelly. You saw the amount per slide that was on there. We use pure stem cells only. We do not mix them with your blood or PRP. Other companies use PRP or spiking. It does not benefit someone when they're older, the PRP. Cortisone injections too close. A lot of times my mom had a cortisone injection about a month before. If you have cortisone in your body for at least 60 days, you're not a candidate because that destroys the joints and will destroy the cells. We have very specific pre-op guidelines. There's no imaging taken on many of these clinics. We do x-ray imaging to see and measure joint space because everything you can measure, we could improve on, right? We have a goal because a lot of our local patients, we could take post-imaging to see the growth of the cartilage in those areas, the soft tissue. There's no placement technology. We use an ultrasound guided or C-arm placement technology. You will actually see it go right into the joint exactly where it needs to go, and you'll see it right there, no guessing whatsoever. There's no post-support bracing. If a candidate and if needs so, you will have support bracing for optimal healing and positioning. And it's not just slapping on a brace. It's very specific. Is it medial? Is it lateral on the knee or the joint? There's no lifestyle factors addressed. We maximize your lifestyles. There's no standardized technique. We have a very specific proprietary certified technique that the Signature Labs approve of. They're very, very strict in the protocols, and our offices, all our 41 offices are trained and certified in that technique that we will not have elsewhere. There's lack of follow-up. We have concierge follow-up. Another reason why we have amazing success rate is we follow up with you 1 week, 1 month, 3 months, 6 months, 9 months, and 12 months. Wow, yeah, we're on you like crazy. Why? Because it's a one and done procedure, but we want to follow you through the entire journey. We're part of your team. We want to help you in other areas. You're going to start saying, hey, I want to start exercising again. I want to start doing these things again. And we want to help you maximize your life in all those areas. We're with you the entire way. You will never feel alone. And we have maintenance programs to help you support the investment and results. Because of on the left, there's been unsatisfactory results, and a lot of people feel, well, this regen thing didn't work for us, or we're too old. You know why? Because you did not have the right details. We're here on the right, you will have faster, superior, and absolute longer lasting and satisfactory results because of the way we do things, our protocols, what we do right, and what we do that's different. So now the choice is yours. You can continue to be in pain and lose that opportunity. And this full circles us around. Like, remember we talked about opportunity cost. You know what? You want to play with your grandkids again. You want to climb the stairs. You want to be able to walk normally. You want to be able to sleep normally. You want that golf game. You want to work on your car. You want to be able to travel. You want to get off the drug. You want to keep your limbs. You want to, stop infections if you have neuropathy. You want to get feeling back in your life. You want to live life on your terms. But the choice is yours. Doing nothing will get you the same results you've been getting, or you could actually choose to do something about it. And many times I get emails from you guys after this webinar, hey, can you help this? Can you help that? And the greatest, most popular answer I could ever give you is, you have to come in, get a consult, let us do the testing, let's sit knee to knee, eye to eye, see what's going on, then we could determine if you're a candidate, what areas need to be done, and if you could start regenerating and having amazing results. We have to see that. We can't guess it. Remember, we don't guess, we test, and we have to be with you to do that. So what I'd like to extend to you guys is this: a first-class regenerative medicine experience today. Our consultations normally are $450 to $1,200 or even more, because we might have to take x-rays of the spine and the knees and the hips, or a neuropathy exam. Like these, just an x-ray view of your hips is $600 at the hospital. So these really add up. Plus you're meeting with us for at least an hour with our case manager and lab and medical staff. So, but that $450, that will include all testing and exams. But my gift to you today, because you made it this far, is if you call within the next 24 hours and you book your consultation and we get you in the books, I'm going to extend an action and investment into you, where the consultation, the webinar special is only $80 bucks. That's it. That includes all tests, all exams, no matter how many we have to do, but that's only if you call within the next 24 hours. So all you have to do is call 281-651-2020. Again, that's 281-651-2020, and we will help you find the location in the area that we'll be able to get you to for your consult. Now, a couple things before you make that consult, before you do it, I want to make sure that there's a couple things that we go over to make sure that you feel that this is the right fit in the next move for you. All right, as we said before, that insurance companies, we went over it. They do not support anything that's helping you prevent chronic conditions, and it's not a drug and it's not a surgery. Also, when you come to the consult, please bring the person closest to you. We require that you bring your spouse, your significant other, or partner, any type of decision maker. If you're single and you make all the decisions, then that's it. Single, widowed, I understand that. But we have noticed that in thousands of patients, the greatest success comes from those who bring their spouse to the first visit, because your spouse will also give us additional information that we normally would not have gotten if they weren't there. And they must play a part, because your health affects their life, and they must see the cause of your condition, what happens if you correct it, what happens if you don't correct it. They need to know all the financial costs, and they have to know everything that needs to be done at home. So both of you together right there can make a very informed, intelligent, logical decision to be able to move forward and get well. And the third thing is we're going to talk about the cost of this. And again, this is why they need to be there as well. Normally, if you just came into our office, this would be the cost. It would be $6,880 for one area, or $10,880 for two areas. What do areas mean? Now, depending on how bad things are, if you do one knee, that's one area. A shoulder, that's one area. But if there's a lot of degeneration, you might have to do one area in the left knee, one area in the right knee. If your neuropathy is over a 40% loss, then we'll do one area in the left leg, one area in the right leg. The only way we could be sure is we must see and test everything at the consultation, and then we could actually see exactly if it's one area or two areas right there. And then we may do additional areas if you want to do the neck or the whole body infusion. But that is the price for one or two areas. But again, my next gift to you is this. If you make your consultation within the next 24 hours, not only is that a reduced consultation fee, but at that consultation, if you meet with our case manager, if you are a candidate and we could accept you as a patient and you choose to move forward, then I will be able to I'm going to extend a seminar discount for you. And so that is the seminar discount for attending the webinar. I'm making it this far because you're concerned about your health. You are always going to save $1,000 savings right there. So it goes down to $58.80 for the one area, $98.80 for 2 areas. And then each additional area is only 4 after that. So you're literally saving $2,800 per area for each additional area. But that only happens if you call now and make your consultation. Call 281-651-2020. That's 281-651-2020. Or there may be a link here to schedule your exam. And also, when you call in, if it's busy, because we get so many calls coming in, if it's busy, please keep on trying until you get a hold of one of our staff to make that appointment. Let them know you watched this webinar so they assure that you could get the 2 gifts that we're giving you, the reduced seminar or the reduced consultation price. And also at your consult, we will honor this seminar discount of $1,000. That's when you make your call and book your appointment in the next 24 hours. So for those of you, thank you so much for your time. Remember, time and health is your greatest commodity. For those of you that are going to make a consult right now, congratulations. If you're a candidate, this is going to absolutely change your life. We look forward to having you live life on your turn again and getting things back in your life that you always want to do. And I do. For those of you that do make the consult, I will promise you this. If you're a candidate and you're able to get these cells, you're going to need a telescope 1 year from now to look back to see how far you came. Thank you so much. Have a great day. We look forward to seeing you. Bye-bye.